Welcome to our NPTE Question of the Day series, presented by Typical PT. Today, we're tackling a case study regarding arterial blood gases. Let's start. Here's our scenario. A 45-year-old male has presented with the following arterial blood gas results show. pH is 7.30. PaO2 is 91 millimeters of mercury. PaCO2 is 36 millimeters of mercury. And HCO3 is 20 milliequivalents per liter. The question asks, which one of the following abnormalities is also likely to be present in laboratory testing? Let's look at our options. A. Hypercalcemia. B. Anemia. C. Hypoglycemia. D. Hyperkalemia. All right, pause the video now and try to answer this question on your own. Once you're done, hit play again and let's check if you got it right. The correct answer is D. Hyperkalemia. Let's walk through why this hyperkalemia is the correct answer. Looking at our ABG values, we can identify this as metabolic acidosis. How do we know? Well, the pH is 7.30, which is below the normal range of 7.35, confirming we have acidosis. The HCO3 is 20 milliequivalents per liter, which is below 22 milliequivalents per liter, indicating a metabolic problem. And if you look at the PaCO2, it's 36 millimeters of mercury, which means it's decreased, not elevated. This is the body's compensatory mechanism trying to blow off CO2 to bring the pH back up. Now here's the key concept. In metabolic acidosis, potassium shifts from inside the cell to the extracellular space. Why does this happen? When the blood becomes more acidic, excess hydrogen ions move into the cells. To maintain electrical neutrality, potassium ions move out of the cells in exchange. The result? Hyperkalemia, which is a representation of an elevated potassium level in the bloodstream. This intracellular-extracellular shift is a classic NPTE association, so make sure you keep it in mind. Now, let's look at this helpful reference chart from the Physical Therapy Essential textbook. This table shows you the ABG patterns for different acid-base disorders. For metabolic acidosis, which is what our patient has, you'll see pH down, decreased. PaCO2, normal. HCO3, down, decreased. Compare this to the other patterns. Respiratory acidosis has decreased pH with increased PaCO2 and normal HCO3. Respiratory alkalosis has increased pH with decreased PaCO2 and normal HCO3. Metabolic alkalosis has increased pH with normal PaCO2 and increased HCO3. The diagram also shows the specific causes of metabolic acidosis: diabetic ketoacidosis, kidney failure, and diarrhea. The symptoms listed include stupor, hyperkalemia, which is exactly what our question is asking about, arrhythmias, muscle twitching, emesis, and decreased cardiac output and deep tendon reflexes. There's even a helpful mnemonic SHAMED to remember these symptoms. Treatment involves insulin therapy for diabetes, IV fluids for dehydration, and sodium bicarbonate in severe acidosis. Now, let's quickly review why the other choices are incorrect. Answer choice A, hypercalcemia, is incorrect because hypercalcemia occurs as a result of alkalosis rather than acidosis. You'll notice in the diagram that alkalosis is on the opposite side of the chart. It's a completely different acid-base disturbance where pH is elevated, not decreased like in our patient. Answer choice B, anemia, is incorrect because blood gas changes do not affect hemoglobin levels. ABG values measure pH, oxygen, and carbon dioxide. They don't tell us anything about red blood cell count or hemoglobin concentration. These are separate lab values entirely. Answer choice C, hypoglycemia, is incorrect because metabolic acidosis may occur in cases of diabetic ketoacidosis, which you can see listed as one of the causes in the diagram. And in DKA, acidosis is linked to hyperglycemia rather than hypoglycemia. The high blood sugar and ketone production are what lead to the acidotic state, so we'd expect elevated glucose, not decreased glucose. The key takeaway here is recognizing metabolic acidosis from ABG values and understanding that acidosis causes potassium to shift out of cells, leading to hyperkalemia. This is critical knowledge for patient management and definitely NPTE material.
Now that you've gone through this case, take a moment to jot down all the key points in your typical PT digital notebook. Use it to organize your notes, highlight concepts you found confusing, or mark areas you want to review later. This feature isn't just for note-taking. It can serve as your personal reviewer, helping you track what you've mastered and identify topics you still need to strengthen, ultimately improving your retention and understanding. Thanks for watching today's question of the day. We're dropping new NPTE prep content every single day to help you pass with confidence. Follow us on Instagram, Facebook, and TikTok at TypicalPT for daily study tips, quick reviews, and motivation to keep you going.